Hi everyone, Dr. Suneel Dhand. Welcome to another video. The healthcare system is a complete mess in many countries. And I wanted to let you know sincerely, because I talk about this a lot, that I really feel your pain. I've been through it myself. I've had experiences with family members, and I know what it's like to be given suboptimal healthcare. When you're suffering, when you really need some help, and the system is not there for you. So I do my best within the system to advocate for positive change. I hope through many of my social media videos and other posts and articles that we can raise awareness and get the needle moving in the right direction. But obviously, one person cannot really change the system. We can only do our very best. But I really wanted to emphasize that to you. Whenever you watch my videos, please know that I understand the frustrations out there. I understand what you're all going through if the healthcare system is failing you. Let me give you some very common examples that not only do I hear about a lot, but I've also experienced, whether it's myself or with family members who've had to navigate the disgraceful maze that is our system. Whether you're in a socialized country and you've paid taxes your whole life, or you're in the United States and you've paid a hefty amount of insurance, isn't it terrible when the system in your hour of need is not there for you? Let's talk about a few examples that I see on an everyday basis. So let's talk first and foremost about primary care. Primary care has been decimated. I think a lot of this is deliberate for different reasons in different countries. Doctors have completely lost their autonomy. Most doctors graduating from medical school have no intention whatsoever of doing primary care for a variety of reasons. And I don't think it's only about pay. I think it's because the job is a bureaucratic mess. It is almost impossible to be a good primary care doctor within the system. Things were very different a few decades ago. So I understand what it's like. I hear stories every day. You can't find a primary care doctor in your area. Those doctors that are there are completely full. They have no space at all. And if you go to your doctor, you're on a merry-go-round. You don't even see the same doctor each time you go. Maybe you have a nurse practitioner or physician assistant. I have nothing against NPs or PAs. In fact, often I think they deliver better care within our current system. I've talked about that before. But if you can't find a basic primary care office with a good doctor to follow up with regularly, then of course that makes any further healthcare very difficult indeed, because you don't have that basic foundational structure in place. Many people out there, I've heard this more in the UK, to even make an appointment, you're left waiting on the phone. You have to show up in your clinic at a certain time in the morning to get an appointment. You can't really make online appointments. I mean, how is that possible in today's day and age that this system hasn't gone online? But those people who are there relay stories to me all the time that they are simply trying to make appointments. Often these are elderly people who have paid taxes their whole lives and they need some basic care, and it's almost impossible to get an appointment. Then if you do have a more focused problem and you need to see a specialist, it can be extraordinarily difficult. This actually tends to happen more in Europe than in the United States, but waiting lists can be incredibly long. So you have a very specific problem, whether it's to do with the heart, you need to see a cardiologist, maybe you need to see a lung doctor, a kidney doctor, a gastroenterologist, but you will be made to wait for a long time. In fact, I've probably heard the longest wait times for orthopedic appointments. That is more so in the United Kingdom. It can take months and months to get hip and knee replacements. In the United States, it's a little bit faster. Then when you do see a doctor finally, often the communication is absolutely abysmal. This actually makes me more angry and upset, because this is something which is in any doctor's control. To be a good communicator, that is often far more important than technical skills in the field of healthcare and medicine. Obviously, you need to have technical skills, you need to have knowledge, but imagine having a brief interaction and coming across as rushed or not caring at all. Nowadays, a lot of times, and again, I blame bureaucracy, a doctor may be glued to their screen, ticking boxes. They barely make eye contact with their patient. What sort of medical interaction is that? If that's happened to you, I feel your pain as well. There you are with an important problem. You want to open up about it. You genuinely want help. And the doctor is not even looking you in the eye and wants to rush you out of the clinic as soon as possible. How about if your doctor is a pill pusher or an injection pusher? They're almost writing the prescription before you've even walked in the room. What sort of medicine is that? How did we get to that paradigm? Because I remember even when I was young, going to a doctor, it was very difficult to get a pill, a prescription, or an injection out for doctor. They would exhaust other possibilities, at least where I was in the south of the United Kingdom. That was not the default, to give anybody coming in a pill or an injection. We have had a complete change in our medical paradigm over the last few decades, and it is to the detriment of good healthcare. So again, I feel your pain if you think that there are other alternatives and all your doctor wants to do is push a pill or an injection at you. Now, doctors or the medical profession might try to push back and say, well, that's what our patients want. That is an utterly ridiculous thing to say. The medical profession should take charge. They need to own up and be all about good medicine, which frequently doesn't involve a prescription a lot of the time, and certainly not giving the impression that you're pushing pills and injections at people who may have other questions or think that something's not quite right. Maybe this injection or this pill isn't right for me. And how about if you have some genuine concerns about side effects or adverse events? You don't want to take a particular pill, or maybe you've been prescribed a drug and you haven't reacted well to it. Maybe something has happened to you which isn't in the medical textbook or what the doctor has been told, the prescribed narrative from their usually corrupted physician authorities, and you feel like you haven't been listened to at all. You've had a bad thing happen to you and the doctor's kind of dismissed it. I feel your pain. That must be absolutely terrible to have that happen to you when you are suffering. And we saw that during the pandemic. If you had certain adverse events or side effects and you tried to even talk about them, you would be completely dismissed, or worse still, you would be ridiculed. And how about when you go and pick up your prescription and the costs are unbelievable? Obviously, this happens more in the United States than in Europe, but even in Europe, you still have to pay a prescription charge. In the United States, it is absolutely ridiculous what the costs are. And often the doctor doesn't even know the costs themselves, because you have to navigate the maze of insurance. And it's only when a patient goes to pick up their prescription that the costs are fully realized, often hundreds of dollars every month. How on earth is anybody supposed to afford that for a medication which may well be necessary? So it's absolutely horrible, particularly when I see elderly people who've worked so hard their whole lives have to part with huge sums of money to afford a basic drug, which is often much cheaper in other countries as well. That is the absolute clincher right there, that pharma companies sell the drugs much cheaper in other countries because they could never get away with their rip-off prices. I feel your pain if that's happened to you. How about if you ever have the misfortune of being admitted to hospital? And you're in the hospital and you're being seen by a number of different doctors, and you keep getting different information, different opinions. It appears that the doctors are not talking to each other. This is what I call too many cooks in the kitchen syndrome for doctors. It happens all the time. One doctor, a cardiologist, will say one thing, then the internist will come and say something else. The renal doctor, the kidney doctor may give a completely different opinion, and the poor patient and the family are wondering what on earth is going on. This happens all the time, and I feel very bad for the patients that I see in the hospital who have this happen to them. Obviously, I do my best as the internal medicine doctor to say I am the captain of the ship. Everything is coming through me and we will work out the plan and I will tell you what's going on. But frequently that doesn't happen, sadly. And I do hear all of the other problems and pain points that people report in the hospital. Maybe you can't sleep. There's a beeping machine. Maybe there's noise coming from your neighbor. Maybe there's noise from the nurse's station outside the room. Maybe something has happened. Of course, there's not always control over noise in the hospital if there's an emergency or something like that. But frequently, the complaints that I hear are very valid indeed. And the strange thing is that this is a basic foundational principle of wellness. How on earth is somebody supposed to recover if they can't rest and if they can't sleep? And it's terrible when people come into hospital and this is their main complaint. What about the food? Let's not talk about that. If I was ever in the hospital, I would avoid any hospital food as it exists right now. I think it's pro-inflammatory. It's an absolute disgrace what hospitals all across the country give patients who are trying to recover. It should be simple, plain, real food. Of course, you can make it tasty, but definitely not processed foods and ridiculous amounts of carbs, sugars, sodas, etc. future generations are going to completely laugh. So if you see that and that's your only option, I feel for you. I know a lot of people have no other option, or maybe they're not aware and they just eat whatever is given to them in the hospital. But if you can see that what you're being given, or you've seen with a family member that what they are eating is not doing their health any good and is actually making their problem much worse, then I see and I hear you. How about when you're in the hospital and you or a loved one are what I call sinking in bed syndrome? You're not getting up, you're not being moved, the nurses are extremely busy, and a simple thing like sitting in the chair 3 times a day, I write that on all my patients unless there's a reason not to, and I write it in capital letters or I type it on the computer, must be done. And if it can't be done, I want the nurse to page me and explain to me why it can't be done, because it's so simple. We cannot let hospital patients sink in bed. I have seen people who are in their 60s, 70s, and 80s, previously independent. They've had an illness, and because they haven't got up and moved, they haven't simply got to the bed, physiotherapy has been delayed, they're not walking around, they end up either going to rehabilitation or, worse still, in long-term care. The body is built to move, and as soon as you're capable of moving in the hospital, you need to. And along that note, there has to be proper supervision. Way too many people still fall in the hospital. This may have happened to you or a loved one. I think it happens much less now because we're more careful. But I would say if there's any risk at all, if somebody's more frail, obviously when they get up and they move, somebody has to be there to watch them do so. People shouldn't be falling in the hospital and injuring themselves. And how about when you're discharged from the hospital? This is what I call the discharge haze. Your discharge instructions make no sense whatsoever. They are mumbo jumbo, printed out on a computer. You can't make head or tail of it. Nothing is clear. You need to know very clearly, well, what to do if you have more symptoms, what should be your first port of call, what should you do if X, Y, Z occur, what you should do for follow-up, which doctors do you need to see, what blood tests, what imaging studies do you need to get done, what's been abnormal in the hospital that needs specific follow-up. I usually print out a separate Word document in big writing, a big font, and I will give it to the patient and their loved one so that everything is clear. You know exactly what needs to happen next. You can't be rushed out of the hospital after you've been sick. That, for very obvious reasons, is a very dangerous thing to do. So those are some pain points that I hear on an everyday basis. But because I talk about these a lot, I want everybody who's watching to know that I feel your pain. I see it every day, and I've experienced it as well. Hospitals, healthcare, clinics, primary care, whatever we're talking about, we have an atrocious situation right now. And I think regardless of political leadership at the top, politicians can come and go. And hopefully right now we have some political leadership which is focused on the right things. Nevertheless, our leaders in healthcare, those doctors, the people with MD or other qualifications after their name. If you're in another country, in Europe, you might have an MBBS after your name. Whatever the qualification is, the basic foundational problem is that our healthcare leaders right now are complete clowns. They are focused on the wrong thing. So you can have whatever politician in charge who is trying to do the right thing. But as long as we have ridiculous, crazy, I would say insane healthcare leaders in place who are not focused on the right thing, sadly, I'm not optimistic that things are going to get better. We need a complete cleanup. We need to really, and I mean this, drain the swamp of medical leadership. We need to get good leaders in there that are focused on the right things for the health and well-being of the population. Because we're very technologically advanced now as a nation. It's 2025, for goodness sake, and we're still struggling with these basic things. People deserve good healthcare, especially in older age, having worked their whole lives, paid taxes, paid insurance. The healthcare system fails too many people on an everyday basis, and we're talking about life and death. So we need to sort this out urgently. We cannot have these same situations coming up time and time again, and somebody knowing that one time they might truly need help in their lives, having expected a healthcare system to be there for them, that it truly fails them in their hour of need. It's a tragic situation, and it actually hurts me as a doctor, somebody who wants people to be well, when I hear these stories. Thanks everyone for watching. Dr. Suneel Dhand. If you're not already signed up for my free newsletter, please do so. Link down below, as are links to all of the other work I do and my website. Feel free to share your stories as well below, or even some solutions. How do we improve the situation? I will certainly talk about that more in a future video. Hit the like button if you like this video, the subscribe button for more similar videos in the future, and we will speak again in the next video.